In nearly every industry, employee slip, trips, and falls typically account for the most frequent and severe causes of injuries. Unfortunately, claims data from Argent confirms that the healthcare industry is not immune to this exposure. In nearly every industry, including healthcare, employee slip, trip, or falls typically account for the most frequent and severe cases of injuries. In 2019, there were 244,000 injuries from slips, trips, or falls that are required time away from work. To help you and your organization understand the negative impact a slip, trip, or fall injury can have, we will walk you through a scenario based on an actual injury that occurred at a skilled nursing community. While going through the scenario, ask yourself the following questions. What was the employee doing prior to the incident? Were there any warning signs that may have alerted the employee to the slip, trip, fall exposure? What or were there any contributing factors leading to this incident? Could this happen at your organization? After viewing the scenario, we ask that you provide answers and further discuss these questions. Then, with the information, you will be able to develop preventative measures. Names of employees, business, and date of injury have been changed to respect privacy to the claimant and insured. Simon, a second shift caregiver with Great Care Skilled Nursing Home, was helping clean up after dinner. A coworker in dietary had called in sick earlier that day, so the department was short-staffed. Aware of this, Simon asked if he could help them by taking out garbage bags to the dumpster located on the outside of the facility. Simon was unsure of the proper procedures to throw the trash in dietary. A few days prior, he had observed a dietary worker use a hand cart when throwing the trash. Simon could not find the hand cart that is typically used to safely move garbage and recyclables to the dumpster. Instead of taking the time to look for the cart, Simon wanted to speed along the process, so he decided to carry the filled garbage bags in one hand and a stack of empty produce garbage boxes in the other hand. Simon knew it had been snowing all day and was expecting the snow to be cleared. The contractor for snow removal for Great Care had been plowing the parking lots as agreed, but the dietary employee who was responsible for clearing the snow and salting to and around the dumpster was out sick. As Simon opened the door to the walkway leading to the dumpsters, he noticed that the light that illuminated this area was not working, as the bulb must have burnt out. Knowing that every minute that passed meant he would be that much later to making his rounds, Simon decided to proceed with walking to the dumpsters. With the stack of boxes partially obstructing his line of sight, and with poor lighting in this area, Simon failed to see the walkway was covered with snow and ice. After a few steps towards the dumpster, Simon fell to the ground, fracturing his wrist and injuring his hip. Luckily, Simon had his radio with him at the time of the injury, so he immediately contacted a coworker who then called 911. Paramedics transported Simon to the hospital in an ambulance. At the hospital, Simon was found to have a fractured wrist and a severe contusion to his right hip. Unfortunately, the wrist fracture was so serious it required immediate surgery and weeks of physical therapy. Simon was unable to work for several weeks following the injury and has permanent physical limitations. Once an avid downhill skier, Simon would be unable to do this ever again. Next, you will be asked a series of questions. Prior to moving along, please pause the video for discussion. What was the employee doing prior to the incident? Helping coworkers in dietary services clean up and take the garbage out. In a hurry to start his round. Were there any warning signs that may have alerted the employees to the slip, trip, fall hazard? The weather had been snowy all day. The stack of boxes was obstructing his vision. What or were there any contributing factors leading to this incident? Simon was in a hurry to start his rounds. Simon was unaware that there was a hand cart typically used to move garbage and recyclables, so he manually lifted and carried it to the dumpster. The light was not working in the dumpster area. Simon was not aware that the snow removal contractor did not take care of the walkway to the dumpster area. Now, could this happen at your organization? Likely, the answer to that question is yes. If that is the case, let's identify preventative measures to ensure this type of injury does not happen at your facility. Use hand carts instead of manually carrying objects. This not only helps reduce manual material handling, but also slip, trip, fall exposures. Do not obstruct your vision with carrying stacks of items. Instead, make multiple trips. Notify building maintenance when lights are not working. Ensure snow removal responsibilities are clearly identified and that contingency plans are in place when responsible parties are not available. As you have seen, slip, trip, fall injuries can be very serious in nature and can have a long-term impact on your health. As an organization, it is critical that you know what to look for when identifying slip, trip, fall hazards and how to take immediate action to prevent potential injuries.